And if you haven't been to a webinar, an I-STARR webinar before, just some notes. The I-STARR project is supported by a grant from the National Institute on Drug Abuse. It's part of the larger NIH Helping to End Addiction Long-Term, or the HEAL initiative. And it's also one of several projects that comprise the Consortium on Addiction Recovery Science, or the COARS network. So this webinar today is actually the 8th training that's geared specifically towards studying recovery housing. It's actually the 10th in this training series. So each webinar in the I-STARR training series for researchers will focus on a specific methodological aspect of research. In addition to providing sort of a primer of sorts on that topic, the webinar will also highlight how recovery housing researchers have addressed that topic or used that technique in their research. And the topic for today's webinar is multi-level modeling. Let's go to the next slide. So I'm Amy Miracle. I'm a research scientist in the Alcohol Research Group at the Public Health Institute. I co-lead the I-STARR project with Dr. Carmen Masson, who's a professor of psychiatry in the School of Medicine at the University of California, San Francisco. But the team also includes co-investigators Sarah Zemore and Lenny Jason, biostatisticians Mina Subbaraman and Libo Lee, communication specialists Diane Schmidt and Dustin Kebsu, and our project is coordinated by Quinoja Capitani. That's the I-STARR team. Let's go to the next slide. So the I-STARR project activities are also guided by a 17-member advisory board. And our advisory board members wear lots of different hats, but collectively they represent recovery and recovery housing leaders, treatment providers and payers, national policy advocates, as well as researchers and educators. I think that we have some of our advisory board members in our audience, but I'm also very pleased to say that many of our advisory board members have presented at these webinars. So it's just a treat to be able to work with our advisory board and to draw on their expertise, which is pretty great. Let's go to the next slide. So before we get into the presentation, I've told you a little bit about the I-STARR project, and we'd like to hear a little bit about who's at the webinar today. So if you can indulge us, let's do some quick polling. They're just 3 questions, and let's launch the poll now. I'll just read the questions so that we can quickly get through the poll. So the first question is, what best describes your field of study? The second is, at what stage in your studies are you in this field? And the final question is, how familiar you are with multi-level modeling. You may have to scroll down to see all the slides. And Zoom won't let you go on until you answer all the questions, but after you have, just hit submit. And after folks have submitted their polling questions, we'll review the results from the poll. Oh, we snuck another question in the polling. I like that. You get a bonus question, more information. Oh, and polling questions are ready. So it looks like in terms of who we have in attendance, there is a good mix of folks representing psychology, sociology, social work, and health sciences. But we have folks from public policy, biostats, and other areas as well. In terms of where people are at in their training, so most have been, well, there's a good split between completing their terminal degree within the past 10 years and with 10 years or more ago. In terms of familiarity with multi-level modeling techniques, we have familiar being the most frequently cited response, but a good mix of folks. It looks like a fairly normal distribution, which is rare to see sometimes. So in terms of using multi-level modeling techniques in research, we have a number of folks who have. So that will be nice to hear from folks who have used these techniques, to have them weigh in with their experience using these techniques. There are folks who are learning this for the first time, but for all folks, we have an example of using these techniques in recovery housing research, which will be a treat for all. So let's go to the next slide. So let me tell you about who you'll be hearing from today. We have two different presenters. We have Meena Subbaraman and Elizabeth Mahoney. And I'm pleased to say that I've been working with these presenters on a variety of different research studies and recovery housing studies for the past 10 years. And I'm so glad that they're presenting at this webinar. They are repeat offenders in the I-STARR training series. Both Meena and Liz have presented before, and we're really glad that we can have them back. So Meena Subbaraman is a biostatistician in the Behavioral Health and Recovery Studies Group at the Public Health Institute. She received her master's degree in statistics from Stanford University and a PhD in epidemiology from UC Berkeley. Her research interests are diverse and include causal inference methods for studying mediators, moderators, and mechanisms of action, recovery from substance use disorders, treatment for alcohol use disorders, recovery housing, as well as cannabis and alcohol policy, to name a few. She's quite prolific. So before joining the Behavioral Health and Recovery Studies Group, she worked in the Alcohol Research Group for 14 years, where she served as the Director of Statistical and Data Services for 2 years. So that's Meena Subbaraman. We'll also be hearing from Elizabeth, or Liz Mahoney, who is a project manager in the Behavioral Health and Recovery Studies program at the Public Health Institute. So Liz received her undergraduate degree in psychology from Boston College and her master's in international disaster psychology from from the University of Denver. Liz is currently managing 2 different sober living house studies, one funded by the National Institute on Drug Abuse and the other study funded by the National Institute on Alcohol Abuse and Alcoholism. She previously worked on another sober living house study focused on testing an intervention for sober living house residents involved in the criminal legal system. So prior to joining PHI, Liz worked at the University of Pennsylvania's Center for Studies of Addiction in the Addiction Treatment and Medication Development Division. So we'll first hear from Dr. Subbaraman, Meena Subbaraman, who will provide an overview of multi-level modeling techniques. And then we'll hear from Liz Mahoney about an application of these techniques in recovery housing research. And with that, let's go to the next slide, and I will hand things off to Dr. Meena Subbaraman.
Thank you so much, Amy. Thanks everyone also for your interest in multi-level modeling. I'm glad to see that there's some folks with some experience with these kinds of models. So I hope that during discussion, you will share your thoughts. Next slide, please. So there are also some folks who don't have experience with multi-level models here. So we're going to start off with some basics. What is a multi-level model? So as you probably know or have worked with, data often have a hierarchical structure. I would even go so far to say as data usually have some hierarchical or clustering within the data set. So perhaps we have nesting of individuals within houses when we're looking at recovery residences, or we have nesting of the residences within neighborhoods, or both. When we have longitudinal data, so data collected over time, we're also dealing inherently with a multi-level data structure because now we have individual responses that are correlated with each other over time. So unlike traditional, or I should say simple regression models, which don't account for these hierarchies, multi-level models do account for these hierarchies, specifically by allowing residual components or variance components for each level in the hierarchy. So for example, we might have a 2-level model that allows for grouping of resident outcomes within houses, and this would include residuals at 2 levels, at the resident level and the house level. And what that amounts to is partitioning the residual variance into these two components, between house and within house. And so now we can better understand, okay, how much variance in the outcome is due to the variance between the houses versus variance within the houses at the resident level. Next slide, please. So why should we use multi-level models? What is the importance of them? Why is it important to use these as opposed to a simple regression model? So the first reason here is probably the most important reason, which is we want to make correct inferences. So with traditional regression techniques, those assume that the observations are independent. They treat the units of analysis as independent. And the problem with that is if we don't account for the hierarchy don't account for the clustering within the data, we will be underestimating our standard errors of the regression coefficients. And that's problematic. We haven't accounted for the similarities either within people or within houses. So we're underestimating the variance, underestimating the standard error. And the consequence of that is overstating statistical significance because our p-values are directly related to our standard errors. So if we underestimate standard error, we might overstate statistical significance. This would lead to incorrect inference, say rejecting the null hypothesis incorrectly, type 1 error. And so this is probably the most important reason to use the multi-level is that we want to make correct inferences and correct the standard errors accordingly when we have multi-level data. Another reason for using multi-level models is that we might have interest in group effects. So a lot of times our research questions have to do with the extent of how groupings affect individual outcomes. So in recovery residency research, we might, for example, be interested in how sober living house characteristics impact substance use among residents. So the sober living house or the sober living houses themselves, these effects would correspond to the house level residuals. And so in a multi-level model, we're able to test the significance of between house variability, which we could not do in a simple regression model. Next slide, please. So two more reasons for using multi-level models. We might want to estimate group effects at the same time as the effects of group level predictors. So what I mean by that, so in a traditional regression model, we can estimate group effects, say house effects, by including dummy variables for each group, say for each house. This model you're probably familiar with. It's an ANOVA model or a fixed effects model. We could also throw in other covariates or predictors that are defined at the group level, say type of house, mixed gender versus single gender house. And in a fixed effects model, the problem is that the effects of our group level predictors, now the type of house, will be correlated with the effects of the dummy variables that we have for each house. So this will make it likely impossible to even run the model, but it will make it impossible to separate out the effects due to each variable, due to the type of house versus the house itself. But in a multi-level model or random effects model, we can estimate the effects of both types of variables. We can partition them out. So the last reason I have listed here for using multi-level models is inference to a population of groups. So in multi-level models, the groups in the sample are assumed to be a random sample from a population of groups. And that allows us to make inferences to that population of, say, recovery residences. With a fixed effects model, on the other hand, we really shouldn't make inferences beyond the groups that we have included in our sample. Next slide, please. So there's two main variations of multi-level models. First, the random effects model, also called a mixed model or hierarchical linear model, HLM. And the second main variation being generalized estimating equations, GEEs. And so the natural question that arises is, well, which one should I be using when I have multi-level data? So I've highlighted here a quote from probably the most widely cited multi-level modeling paper of all time, To GEE or Not to GEE. It also has a fabulous title. And Hubbard et al. Highlighted here reasons for why the mixed model has generally been favored in multi-level or specifically neighborhood effects literature. And so they say, In the neighborhood effects literature, the mixed model has been favored, perhaps because it involves explicit modeling and partitioning of the covariant structure of the outcomes within and between neighborhoods. And so this is really the key of the mixed model, that partitioning the variance allows the calculation of the proportion of variance in the outcome due to neighborhood-to-neighborhood variation against that due to the variance among individuals within the neighborhood, as well as changes in these variance components after adjustment for exposures and confounders at both levels. So I'm really emphasizing this point because that's the key to a mixed model, is our ability to partition the variance. So, and Hubbard says the ability to partition the variance within and between neighborhoods is an alluring feature of mixed models, but it is only one of a larger set of issues that should be considered. So let's talk about some other issues that we should consider. Next slide, please. So this table is also from the Hubbard et al. Paper, and it really nicely summarizes the differences between mixed models and GEE. So I'm going to focus on the first 3 lines of the table. First off, the focus of interest for each. So for mixed models, we are able to, again, partition the variance into components, and we're also able to get regression coefficients that help us estimate the association between our exposure and outcome, for example. For GEE, on the other hand, it's really the regression coefficients, say that beta coefficient, that we're interested in. So one of the main differences also between these 2 methods is the way that the parameters are interpreted. So for a mixed model, we interpret our parameters, say our beta coefficient, as neighborhood specific. And what that means is our beta coefficient is the change in the mean outcome for a unit change in the associated neighborhood exposure, keeping the random effect fixed. Okay, and so that is the key for this interpretation of mixed models that makes it neighborhood specific, that we're keeping the random effect fixed. For a GEE, our parameter interpretation is population average. And what that means is we interpret, say, our beta coefficient as the change in the mean outcome for a unit change in the associated neighborhood exposure across all of the neighborhoods observed. So you can see how these interpretations are different, neighborhood specific versus population average. At the same time, you can see I have an asterisk here noting the estimates are equivalent. So for linear models, the results from a mixed model and a GEE will actually be the same, assuming exchangeable working correlation in the GEE. So if you run the exact same covariance, same model specification in a mixed model versus a GEE, for a linear model, you will get the same beta coefficient, but the interpretation of it is different, as noted here. Next slide, please. So a little bit more about parameter interpretation. So for mixed models, the fixed effects represent the average effect of the predictors on outcomes across all levels of the model. Again, keeping the random effects, say, the house fixed. And the fixed effects are assumed constant across higher level units, so say across the houses or across neighborhoods. The random effects are what capture the variability between the higher level units. So say between the houses or between the neighborhoods, and how much each one deviates from the average. That's what the random effect is. Mixed models make an assumption that's specific to mixed models, which has to do with the distribution of the random effects. So mixed models assume that the random effects are normally distributed. Next slide, please. So for GEEs, again, the interpretation of the parameters is now population averaged instead of, say, neighborhood specific or group specific. And instead of assuming a distribution for the random effects, now GEE requires specifying the correlation structure. So an exchangeable, independent, autoregressive. So that is a requirement for running a GEE, is specifying that correlation structure. And because GEE can estimate robust standard errors, it makes it more robust than mixed models to violations of distributional assumptions. So other assumptions that are common to both mixed models and GEE. I have listed here. And if you have worked with regression models, then most of these are relevant for simple regression models as well, traditional regression. So the first assumption of linearity, again, both mixed models and GE assume linearity, meaning that the effect of the predictor variables on the outcome is additive and constant. Both methods also assume independence. So after we've accounted for clustering by neighborhoods or clustering by time or within individuals, we are now assuming that after that has been accounted for, the observations are independent of each other. So there's no more systematic patterns of dependence remaining in the data after we've accounted for the multi-level structure. Another assumption, again, and this is, I'm sorry, so another assumption of both mixed methods and GEE is a correct specification of the correlation structure. So the correlation structure is what accounts for the within cluster dependencies, and we want to make sure that we correctly specify that. Different correlation structures include exchangeable, autoregressive, and unstructured, as mentioned. In practice, it is worth, I think, running all of these different kinds and comparing results, seeing what happens. But also, of course, you want to have subject matter expertise and some rationale for why you might choose exchangeable versus autoregressive versus unstructured. Next slide, please. So other assumptions, normality of residuals. This is a traditional regression assumption as well. So as I mentioned, GEE is less sensitive to distributional assumptions compared to mixed models. But both methods do assume that the residuals or the errors are normally distributed. Both methods also assume homoscedasticity. So that means that the variance of the outcome is constant across all levels of the predictor. Excuse me. And finally, both methods and traditional regression methods assume model specification, so that the model is correctly specified. So right, so both mixed models and GE require that we've specified the correct model structure. What that means is that we've included the correct covariates, we've adjusted for confounding correctly, we've specified the functional form correctly. And this can be difficult to do. I'm going to reiterate this in a couple of slides. It's challenging to get the model specification correct. Again, I have noted here that GEE is usually more robust to violations of these assumptions. So it's something to keep in mind when choosing between GEE and mixed models. Next slide, please. So I have listed here the most common packages, commands for running mixed models in GEE in each of our favorite statistical software packages, Stata, SAS, and R. But if folks who have experience with these models use other commands or other packages, we'd love to hear about it. Feel free to put it in the chat or bring it up during the discussion portion of today. Next slide, please. So some common challenges that come up with multi-level models. The first three I have listed here. So data availability and quality, as well as sample size. Those are issues that can come up in any sort of research study. Of course, you want the best quality data you want to ensure adequate sample sizes. Model complexity can definitely become an issue with multi-level models. The more levels you have, the more complex the model becomes. We didn't have time today, I'm sorry, to talk about interactions between the levels, but that certainly can make your model very complex. It can be difficult to interpret. It can be computationally intensive. So that can be challenging. Next slide, please. There you go, thank you. So other common challenges with running multi-level models, convergence issues. This definitely happens all the time in practice, running into issues with models not converging. So this might happen because of poor starting values or because of model misspecification, because of computational limitations. So if you run into convergence issues, you'll have to do some sort of convergence diagnostics. I often start with simply removing variables from the model and trying to identify which variable might be causing the problem, but also looking at distributions of your covariates, of your outcomes, of your exposure of interest at each level can be helpful for diagnosing convergence problems. So as I mentioned, under assumptions, model specification can be really challenging. Knowing whether you have adjusted for confounding correctly, included all of the right covariates, included the interactions correctly, all of these, even, should you dichotomize your outcome? This is something that we are dealing with right now in one of our studies. Should we keep it continuous? Should we dichotomize it? All of these can affect whether your model runs. Of course, it can affect the results. So it can be extremely difficult to feel confident about your model specification. And in practice, I recommend running different kinds of models and whatever is the most robust and also falls in line with your subject matter expertise is usually the way to go. And finally, the interpretation of random effects. So interpreting random effects in multi-level models can be very difficult. Understanding variability between the groups, understanding and determining whether random effects are even necessary for modeling. Do we have enough between group variability to necessitate a random effect? Well, that can require careful consideration, subject matter expertise, as well as preliminary analyses. And I think our speaker today actually has a great example of just this. And so I'm going to go ahead and pass it on to Liz. Thank you.
Okay, great. All right, thanks, Mina. I am going to talk about an example of multi-level modeling in a study where I was the project manager, and the study PI was Dr. Polson. I've spoken about this study in a prior I-STARR webinar, but here's a quick refresher. It was a longitudinal repeated measure design study that was conducted in Los Angeles County from 2018 to 2021. The interviews were conducted with sober living residents at baseline and then at 6 and 12 months later. And I'm going to present why we set up the study the way we did and how we analyzed the data using multi-level modeling. Next slide. So previous research had shown that sober living residents made improvements on measures of substance use, arrest, psychiatric severity, and employment, and factors at the individual level, such as their social network and 12-step involvement predicted outcomes. However, in our previous research, we didn't look at how environmental factors, such as neighborhood characteristics, architectural features of the house, or the social environment within the houses affected outcomes. So the goal with this was to enroll 600 participants from at least 40 sober living houses to examine these multi-level aims. Next slide. So this slide shows the results of analyses by Dr. Miracle that looked at the distribution of sober living houses in the LA area and the characteristics of these neighborhoods. This map is a good visualization of neighborhood level data and was a catalyst for our study to look at the impact of house and neighborhood factors on resident outcomes. So in sober livings, we often say the setting is the service, but what house and neighborhood factors are important as part of the sober living house setting. So when resources are limited, as they often sadly are, what should be prioritized? So next slide, please. So to answer these questions, we plan to use the multi-level modeling for this research because, as Dr. Subaraman just explained, it's good for accounting for those correlations within nested and longitudinal data. So as you can see here, we had 3 levels of data. So each neighborhood has houses within it. Those houses then have the participants within it, and then you have the participant level. So you have the 3 levels. So next slide, please. So level 1 is the resident or participant level data. So since we were conducting multiple interviews with them, we wanted to account for how the responses would be correlated within each person. So in repeated measures, the residents themselves become a random factor that you want to account for. So then we had our level 2 sober living house data. And then at the top, we have our level 3 data for the neighborhoods of the sober living houses. And those were defined by their census tracts. So these levels of data allow us to fulfill the goals that we had in this study. And you can see how at each level we assigned a random unique ID. So this allowed us to collect data at that level, then later merge the data sets on these IDs to make sure that each participant has the data for every level. Next slide, please. So you can see here, this is a visualization how every neighborhood where you have houses and participants now looks like this. It just gets multiplied. So these participants in our study, they may move to a new sober living house in a new neighborhood and everything, but we captured just where they were for their baseline interview house. Next slide, please. So how did we collect the multi-level data? So we broke our recruitment into 2 steps. So first we selected the houses based on the neighborhood SES to make sure that we had a good distribution of that. And we set a cap of 3 houses from a single neighborhood. We then recruited the house level to ensure that we have permission from them to recruit from the participants from their house. And then we would approach any new residents that came in. And we would recruit from that house until we reach that recruitment cap to try to avoid overrepresentation of any house in our data set. Next slide, please. All right, so here you can kind of see in the middle column has the goals that we had, and then the right column has the reality of the recruitment. So we had goals at each level that we tracked throughout the study. We regularly reviewed participant level metrics for number of women enrolled, the house level for how many people we were getting from each house, and the distribution of the SES for the neighborhoods. So we ended up having 557 participants from 48 houses in 44 neighborhoods. And only 19 of our houses reached that recruitment goal of 15 participants, but we did a fairly good job with getting close on the distribution of SES across the neighborhoods, and we exceeded that goal for the women. So this is just a good reminder that good to go in with a recruitment plan for when you have this kind of research and a longer timeline also than you think you'll need. But it's also good to regularly meet as a team to review these metrics to make sure that you're staying on task. Okay, next slide. All right, so this shows the examples of the resident level data, and those sources were from the interviews that we did. And this, we did collect assessments about higher level stuff. So we had asked them what they thought of the house environment and the neighborhood, but that's still considered level 1 data because it's collected from each participant at that level, and it can differ across that level. Next slide, please. And here you can see examples of the data we collected at the house level, and these we got from house manager interviews and just information that we had about the house. Next level, please. Next slide. And here is some of the data we collected at the neighborhood level. So we got a lot from the U.S. Census Bureau's American Community Surveys, such as the percentage of houses with income over 75,000. We also have their walk score, and then we also have data from SAMHSA and the California Department of Alcoholic Beverages to kind of look at the proximity and density measures. Next slide, please. All right, so now we're kind of getting into the steps we lay out for our multi-level model building. So just one big thing is you have to make sure that you're shaping your data to a long data format. So you have separate rows for each participant for every possible time point because it's a longitudinal study. So we had rows for interviews, even if that interview was missed and data wasn't collected. So, and multi-level models are a little bit more flexible in handling missing data. And so we left those as missing. And just if you plan on doing any of those interactions that Mina had mentioned, you would want to center it just to make sure it's kind of easier to interpret your intercept, because the intercepts would then be for the average person. And just like most models, you want to be graphing them and also looking at your correlations just to get an idea of what's going on. You'll also want to run empty models with just the dependent variable and the random effects to get the interclass coefficients. So this will let you know how much variability in the outcome is at each level. So that'll come out, it's on a scale of 0 to 1 with higher scores indicating more variability at that level. So then if they're really low, say below like 0.05, then you may not need to include those random effects, but you could still include them if you were theoretically interested in them. So we plan to run these initial models for each predictor that we were looking at, then final models with the significant factors from the earlier models. And you can then determine your final models by choosing these, by looking at those with lower AICs and BICs, but kind of keeping in mind that you're going to be decreasing precision as you add those on. Next slide, please. So this goes into how we actually analyze some of the data for one of our papers on how neighborhood characteristics are related to resident outcomes. So I'm going to go through these just to kind of give you a sense of the STATA syntax. That STATA has great trainings and everything on specifically all the different components. But this is more just to kind of talk about breaking down that model building that we did for this study. And we're going to specifically look at percent days absence, which we'll refer to as PDA here. And so here we're using the mixed command, and here levels are then become referred to as random factors in these mixed models. Next slide, please. So this is our empty model we ran to get the ICC. So mass underscore TRCT is the neighborhood level. We later had troubles with the models converging, so we dropped those random effects for the house since we were really interested in looking at neighborhood level effects on outcomes and the effective grouping the responses at both these levels was so similar. So you can see here that ICC of 0.063 for the neighborhood level data. So that means that there's 6.3% of the variability is at that neighborhood level. And then when we, it's not shown here, but when we took out the house factor, the ICC for the participant ID went up to 0.21. So you can see as you add factors to your model, as you go on, you'll start to explain a proportion of the variance. So you'll see these numbers go down. Next slide, please. So our next step was to look at any potential covariates based on the literature. You can also use a walled test to see if these adding these covariants adds a significant improvement. So we decided to include age, sex, race, ethnicity, and interview in the place for time. And we included these in all of our later models when we were looking at the separate models for personal and neighborhood characteristics. Next slide, please. So this one, we began to run just one at a time, looking at the personal characteristics for predicting PDA. And this one, you would also be guided by, your literature research. So big ones we're usually interested in this are recovery capital, social networks, motivation. And you can also see here, we also have, I threw in an example for a different outcome, but just to show that we use Tobit models here for this one, just to kind of say that you can also do other types of modeling within this mixed command. Next slide, please. Then we started looking at the neighborhood level characteristics. And so we did this for each one we were interested in looking at. So some examples are looking at that density of the alcohol outlets in the neighborhood, the time to the closest treatment facility, the number of mental health facilities within 1 mile. So we're running all of these separately just to get a sense of what these neighborhood level variables, how they are related to our outcome for the percent days absent. Next slide, please. So then we start working on our final models. And if you run into convergence issues at all, my number one tip is always just start all over and start adding one variable at a time. We had also, step one, when we had been looking at the correlations, we knew we had issues with multicollinearity for some of the neighborhood variables. So like mental health outpatient within 10 miles and substance abuse treatment within 10 miles was like very correlated. So we compared models that separated out those variables, and then you use your model fit test to kind of determine which models to go with. So some people prefer looking at the AICs or the BICs, and then for these nested models, you can use the walled test, and that lets you isolate specific variables to see what they kind of add to your model, and then, or you could look at a likelihood ratio test to compare 2 different models. Next slide, please. And this slide shows all that you could potentially include for mixed models when you're presenting it, and what's considered good practice. So that part at the bottom where it has that model summary and all those different statistics can really help other people evaluate your models and kind of see as you go through each step when you're showing your null models, you're showing your separate predictors, and you're showing your simultaneous models, they can get a sense of how it evolved. Next slide, please. And then these next few slides, I just wanted to show how we actually ended up presenting our data. So we decided we wanted a simpler presentation that focused on the results for the fixed effects and put those fit statistics in the paper. So here you can first see this shows our separate models, and the we have different outcomes here, but there's one there for PDA that shows when we were looking at some of those separate, an example of some of those separate factors, what we came up with for that. And then next slide, please. And then this one is our final model that simultaneously analyzed the significant factors from the prior table. So this is, you know, before you go into this is also good kind of what Mina was talking about of comparing to other models. So we also looked at the GEEs for this. We looked at different covariance structures. You know, this is where you can kind of do your sensitivity testing, kind of see like how these models hold up. All right, so that's the example of multi-level models looking at residents and their neighborhoods. And back to Amy.
Wow, Liz and Mina, you did just a fantastic job with that, a really complex topic. And Mina, I always appreciate your presentation that is minus a lot of math. At least for me, explaining the concepts instead of just putting a formula on a slide. I really appreciate you walking us through that. But really great information. We tried to cover as much as we could on this topic within the context of this hour-long webinar, but there is probably so much more that could be said about multi-level modeling and about the research that Liz has worked on. So we've pulled together some resources for folks. Let's go to the next slide. So we curated a list of some key articles where you can learn more about this methodology and the issues that come up in multi-level modeling. And the next slide is where you can learn more about the examples that Liz presented. So those are resources for you folks, and we can drop those links to those articles. I think they're all publicly available into the chat so that you can click on the hyperlink and get to them as quickly as possible. So let's go to the next slide. You guys have been very patient, holding off your questions until the Q&A and discussion period. We are now here. So feel free to raise your hand within Zoom, or if you have a question, you can type it into the chat. You can also unmute yourself and pipe in that way as well. So let's turn to questions. Any questions from the group? I will let people cogitate, but actually, Angela, let's go to your question first because I have several as well. Angela, do you want to unmute yourself?
Yeah, and I can turn my video on too. I mean, I'm honestly a little nervous about asking this because I just don't know a lot about these methods, which is why I'm here. But I was just curious and thinking about the work that peer support specialists do and how that differs by employer type, community setting in which the activity is performed, perhaps stage of change of the population or age of the population. Are there ways that you can see how this might be helpful in better understanding peer work? Since we're not using participants or clients as the outcome, more about their work. So I'm not sure, perhaps you need an outcome. I'm talking this through obviously as I'm thinking it.
So Liz and Mina, I will let you jump in, but Angela, I can definitely see you at some point wanting to move to multi-level modeling, if you wanted to look at an organization's impact on the peer worker. So you'd be collecting data on the peer worker, but peer workers are nested within organizations, and those organizational characteristics may impact whatever you're measuring at the peer worker level. So I can definitely see parallels from the recovery housing research world to just looking at peer support services. Amina and Liz, do you have anything to add to that? Angela, does that help you with your question?
Yeah, it does.
Maybe
Thank-
inspire you to think more about these models?
Yeah, and I'll take it to the team that's helping me sort of figure out next steps and share what you've said. Thank you so much.
Excellent. I see, I thought I saw Steve Belenko's hand.
Yes, you did. Thanks, Amy. Great presentation, really helpful. Thank you. Just had a question about the ICCs and what the kind of guidelines are for when the threshold for when you would need multi-level modeling. In the example, it was, I think, 6.3% of the variance was, level 2, but there was a very wide confidence interval, and I wonder if that should be taken into account, or if there's a kind of minimum threshold where multi-level modeling would be warranted. I know that probably no simple answer to that, but just wanted
No,
your
but
guide.
that's a great question. And that was one of my questions as well, is that we could revisit the ICC and think about how to use that diagnostically in this process. So Mina and Liz, do you want to weigh in on that?
Yeah, I mean, I would more defer to Mina with this, but yeah, for that, I mean, it's one that it's definitely, they tend to not be that high a lot of the times in the literature, especially in like the sober living house literature, just because there are so many other sources of variability. But yeah, that's why we, as I said, like you could still go ahead with it if you were interested in, but for us, that was what we had found and knew that we wanted to look at that.
And I'll just say too that so I think of the ICC, the interclass correlation. That's ICC, right? I think of that as a signal that I should be doing multi-level modeling. If there's a high ICC, there's a variance at that, there's clustering. I use the term clustering because although partitioning of variance is a much more elegant way to put it, there's clustering I need to account for in my modeling of the effects. And if I don't model that, I'll run into the type 1 error problems that Mina mentioned. I have argued for not using a multi-level modeling approach or reducing the number of levels in papers, but it was pretty low, negligible in my estimation. And what I was able to argue was kind of, at less than 0.2.
Yeah, so there is no like standard for a threshold, but in practice, when the ICC is very low, then including the random effect or not shouldn't make much of a difference. And yeah, and like Amy mentioned, it's really the clustering of the standard errors in a grouping or multi-level situation that's critical to account for, whether or not that's with the random effect or with like a clustering command for the standard error.
And Mina and Liz, I will out myself as a Stata user. If I remember correctly, you can't get the XTGEE to give you an ICC. That you would have to run it in the mixed level model to get the ICC.
Correct.
Yes.
Correct.
Yes.
A GE, again, it doesn't partition the variance the same way that a mixed model does.
Yep, it can account for the clustering, but you can't partition it in the same way that you can with a mixed model. So kind of the more complex the model, the higher the interclass correlation that might guide you into the GE versus the mixed level, or kind of inform your decision on that topic. Other questions? So I'm going to ask another tough one. So Mina, you had as part of your presentation, I think that you mentioned one of the challenges is an adequate sample size. Have you run into anything in the literature that hints at what that adequate sample size might be, or are there guidelines around that?
Yeah, so I think with GEE, I have read that 30 is a minimum sample size. I don't know if that's considered a standard, but I have seen that in the literature. With the mixed models, it becomes trickier, of course, depending on how many levels you have and ensuring that there's adequate sample size within each level and then distributed across the covariates correctly. That can be very, very challenging. So, right, and the sample size will be a factor of how many levels you have and how many crucial covariates you have.
Is there a textbook? So you guys were great in listing publicly available articles that people could access. But in your learning about these techniques, is there a specific textbook that you guys lean on or could recommend?
I don't remember what the name is off the top of my head, but the author, Sophia Ray Pesketh, has fabulous textbooks on multi-level modeling.
And in your mind, would you say multi-level modeling and HLM would be synonymous, or are there distinctions between the two?
I think HLM is specifically for mixed models, like mixed models, random effects, HLM. And then there's GEE. And so both GEE and HLM / random effects / mixed models fall under the umbrella of multi-level models.
Excellent,
I
excellent.
think, but
I like
think
that
also
typology. No, I think that fits really well.
But it is, sorry, just my last thought, it is discipline specific. So, you know, I'm coming from epidemiology.
Any other questions, folks, before we wrap up? Well, if you think of anything, continue to drop any questions that you have into the chat. We'll collect them. I'll try and answer them the best that we can. But let's go to the next slide. So just some updates about what's coming down the road in the I-STARR project. So we have a couple of webinars in April, one for recovery housing operators or providers. And the topic for that is participating in research. And I'm really excited to say that we have Liz Mahoney back for that webinar. And for the researchers, we have a webinar on the many challenges of operating a recovery residence. And that's going to be a really fantastic webinar as well, because we have Fred Wave from the National Alliance for Recovery Residences presenting. And that is I think it's just going to be fabulous because I learned about the many challenges of operating a recovery residence as a researcher, Fred Way, when I was doing my research on recovery housing in Philadelphia. And so I'm really excited that we get to share at the researcher webinar, his knowledge and his experience so that young researchers can learn about recovery housing from him as well. So the I-STARR webinars are held on Tuesdays, always from 11 to 12 for folks on the West Coast, which is 2 to 3 for folks on the East Coast. The provider webinars are usually are always the first Tuesday of the month. The researcher webinars are the third Tuesday of the month. We really hope that we'll see you guys at either one of those webinars because I think that both will be fantastic. And so the only other thing I want to draw your attention to is that I mentioned that I-STARR is part of the COARS, the Consortium on Addiction Recovery Science, and they are hosting the first ever National Conference on Addiction Recovery Science, the NCARS Conference. And that is going to be a virtual conference in April, the 24th and the 25th. And registration is still open. In fact, if you register before the 25th, you can get the early bird discount rate. If you like the stuff that you're hearing at presentations in this webinar series, there'll be opportunities to hear more about not only recovery housing research, but all kinds of recovery science. So I hope that folks get connected with that. Let's go to the next slide, because I also want to talk to folks who have registered for the I-STARR Researcher Training Series. So this is just one webinar that is a part of 12 different webinars in a series that folks can actually get a certificate of completion for doing all 12. Not only get a certificate of completion, but we can list folks who've attended all 12 webinars on our website as folks who have been trained in recovery housing research. To facilitate tracking and making sure that we give credit to everyone who's attended our webinar series, I want to turn things over to my colleague Dustin Kebsu to talk about our learning management system.
Hi everyone, just to be very brief to close out, we wanted to give another plug to our LMS training series. And second, we really wanted to let everyone know that if you enrolled in the live training series where you're unable to attend any of the webinars, that's not a problem at all. You can still earn credit by completing the series by catching up on the LMS. All you really need to do is just send us an email at istarr@arg.org with your name and just list the different webinars that you might have missed. And we will send you the link to the corresponding lessons on the LMS, which you can complete at your own pace. And if you have any questions, just reach out. And with that, I'm going to turn it back over to Amy to close out today's presentation.
Excellent. Yeah, so we're at our last slide and we're running out of time, but just want to thank our presenters today, Mina and Liz. Fantastic job. Thanks for everyone for showing up, all your good questions. Like I said, I hope that we get to see you back at another webinar sometime next month. Take care, folks.